Welcome to this YouTube Live about natural desiccated thyroid. My name is Dr. Alan Christianson, and I'm a board-certified naturopathic endocrinologist with 30 years of focus on natural thyroid care. Natural thyroid has been in use for over 100 years, and for many people, they've done better on that when nothing else really helped them. But there's a lot of questions about who it's good for, who it's not, if it's going to remain available or not, if it's being taken from the market. When is it indicated? When should it not be used? How do you compare that to synthetic thyroid? I want to talk about all these things and more, give you a lot of clarity on that. I see a bunch of you back on, so welcome, welcome. If you have specific questions about natural thyroid, please put those in. I will keep an eye on those and be sure to cover those directly. Okay, I'm going to pull that mic off and get my talking points up in front of me here and start diving on in. So first off, just to quickly mention the proposed ban and what's up with that, kind of a curious thing. The status before August 6th was that manufacturers of natural thyroid were told they had several years to complete a second level approval process. And it's odd they had to do that because natural thyroid was in use before the FDA existed, quite literally by many years. So they were grandfathered in. And that's true of also many things like aspirin or digoxin or lots of medications that were used historically are considered not FDA approved because they didn't have to be FDA approved because they existed before the FDA. So that's how natural thyroid was not approved. They were calling it unapproved. And then they changed things and said, basically on August 6th, they put a statement out saying that the manufacturers have a year to complete this process, or we're going to simply revoke access entirely. And the manufacturer's process they were undergoing was one that everyone knew would take them many, many years, and that a year was simply not possible. So that was the first statement. It sounded pretty grim and as if there really were no options. They were encouraging doctors to help patients find other options. Then many of the thyroid experts, myself and some friends, connected people to really engage the FDA and let them know that they needed to have more time and a more transparent process and not simply take this option out before it was even available. And so that appeared to be successful. The FDA released a tweet, the director did, saying that they will be sure that people retain access to natural thyroid. The reaction that was received, I think it's pretty safe to assume that it will be staying available. Can't assume that 100%, and I will talk too about how one would change if natural thyroid were not available. What other options would there be and how would that work out? So that's where things stand. It looks like it will remain available, but there's nothing official about that just yet. So how is it different? There's two categories of thyroid medicines on the market that are prescription. There's the synthetic and the natural. And the nomenclature here is pretty odd because when we talk about hormone replacement, what we mean by natural hormones are those that are chemically the same as what the body makes. But when we're talking about thyroid hormones, natural means taken from a natural source as opposed to synthesized. Now, that's not the nomenclature we use for estrogen, for example. So natural thyroid is basically freeze-dried pig thyroid tissue. Synthetic thyroid is manufactured. Now, natural estrogen is manufactured. It's still chemically identical. So it's not that it's a bad thing or foreign or weird. It's just that it's one molecule. So natural thyroid has at least 3 biologically active molecules, T4, T3, and T2. There probably are others as well. And much of its effects seem to be correlated with the presence of T3 and T4 together, as opposed to just T4. But some argue that it's more than that. Some argue that even with T3, there are those who have different effects and different symptom responses when they're taking natural thyroid. And I've heard many say that. So classic scenario, someone could be on thyroid medication and they're on what should be a good enough dose. In theory, their blood levels are all normalized or optimized, but they're not really feeling good yet. They're still struggling with their weight. The energy is not back where it should be. Things are off in some way. And when they switch over to natural thyroid and stabilize, those symptoms can improve. So these things have happened. I've seen them happen countless times. Now, it's not always the case. There's many times in which when someone's on thyroid medication and not feeling well, it's not because they're on the wrong category of medication. There's many things that are more common than that. Probably the most common single factor is they don't need to be on medication. They're put in the medicine, but it's not necessary for them. And in those cases, there's really no amount of trial and error or tweaking of dose or types that's going to make things work because it's just not needed to begin with. So how do you know if you're on medication unnecessarily? Simplest thing is think about what your diagnosis and your thyroid levels were before starting on medication. If your thyroid was really shutting down, meaning that your TSH was super high, T4 was way below range, T3 was way below range, we call that overt hypothyroid. In those cases, medications are appropriate. It's pretty surprising, but all the best evidence today suggests that in anything less than the situation, medicines don't consistently help over the long term. The next category that's milder is called subclinical hypothyroidism. And that's where the TSH is elevated, but the T4 is still being made. Now, in this case, the person can be symptomatic, but their thyroid hasn't actually shut off. They're still making thyroid hormones. And when they're given thyroid medication, sometimes they do improve in symptoms for a while. But over the long term, when we look at group results comparing just that variable, there's really not a big net benefit. And here's the thing, I know for a fact that there's many cases in where people have had thyroid levels that are not that severe, maybe even normal, but not optimal. And they felt better going on medications. It totally happens. But in those situations, medications usually weren't the only variable. So what I mean by that is they were also doing more changes like lifestyle changes or diet change or adding in nutraceuticals. They did a couple of things at once. And even as a natural medicine doctor, I've often been tempted to think about the medications as being the part that made a big difference. But the nice thing about the studies that have been done is they've let us see what happens when medication is the only change, when it was done without diet, supplements, lifestyle change, whatever else. And in those cases, there's no net lasting benefit. But there are drawbacks. So the first thing to think about is, do you need thyroid medication? If not, you probably won't benefit by changing types. The next thing to think about is, has your dose been optimized? For those that need thyroid medication, they often don't feel better until their TSH is low normal. It shouldn't ever be below range for a length of time, but low normal can make a big difference. So those are two easy steps to think through. And if someone has done those, then we also think about comorbidities. There's many ways by which people don't use thyroid hormones well, regardless of if they're from your thyroid or from a medication because of other illnesses. So they may be anemic, or their cortisol levels may not be stable, or they could have parathyroid disease or fatty liver or many other conditions. And if these things are there, that's often why they're not responding well to the medication. It's not as much the medication's fault. We call those comorbidities. Those are secondary conditions that are really common with thyroid disease. So if you're past that point, if you need meds, you've already taken the best amounts, you've really identified and managed the big comorbidities, but you're struggling in some ways, natural thyroid might be a good solution. And here's how those things compare in potency. So every 100 micrograms of T4, like Synthroid, is about the potency of 60 milligrams of natural thyroid. This would be like Armour Thyroid or NP thyroid most commonly. Now I say about the same. There have been studies looking at how these things compare in people. And most people need a slightly higher dose than you would expect, but not everyone. Some need just that conversion that I mentioned. So 100 micrograms of T4 to about 60 milligrams of natural thyroid. Natural thyroid, they also describe the potency in grain units. That's the same as 1 grain. So the take-home message is that if you are changing to natural thyroid, it's smart to not do more than that out of the gate, but it's really smart to check your scores and expect to do a couple of adjustments in the short term. The difficulty about assuming that a higher dose is going to work is that sometimes it doesn't, and a higher dose is dangerous. A dose that's lower than ideal is not good, and it's not pleasant, and it doesn't help the symptoms, but a higher dose can be really dangerous in the short term. So better to err on the common side and adjust upwards as needed. One more thing about this conversion, someone doesn't have to taper down and taper up. They can just switch over to convert. So if someone's taking 100 micrograms of Synthroid, they're going to change. They can just stop the 100 micrograms on Tuesday and start the 60 Armour on Wednesday. So not a big elaborate taper process. So other forms of natural thyroid, there's a few different versions on the market to think about that I made notes on. There's also compounded forms of it. Now, the cool thing about that is you can have all kinds of exacting potencies, not just the ones that are pre-made. The drawback about it is that there's a quality control process step that doesn't happen. It's not required for the compounded meds. So the difficulty is they don't have the same potencies as consistently. And we do see that there have been a higher rate of recalls with them to where they're off by big amounts. There's also non-prescription versions of stuff kind of like natural thyroid. So they're often bovine, which is cow-based, and they're often called thyroid glandulars, but they're freeze-dried cow-based thyroid tissue. There even are some pig-based products that are on the market that are not prescription. And these things are a lot like the prescription natural thyroid like Armour, but the drawback is there's a lot of standardizing steps that they don't go through. They don't really go through any of them. And we know that the raw materials have active thyroid hormones, but the amounts can vary so much. They can just vary tremendously from one time to the next. So yeah, if you're just coming on like some of you are, we're talking about natural thyroid. I'm Dr. Alan Christianson, and I'd love to hear your questions. If there were live questions or comments you had about this topic, put them up. I'll keep an eye out for those and happy to address those directly in the event as well. So yes, there are other forms of that, like the compounded and the non-prescription. In terms of current brands in the market, we've got Armour Thyroid, NP Thyroid, and Adthyza. There's one coming on the market soon called Synthroid, and Adthyza may not be remaining on the market. So the two ones right now that are most relevant are Armour Thyroid and NP Thyroid. The active ingredients are the same. There's just one company in the US that makes the powder that goes into natural thyroid. There's some talk about that being from China, from this company or that one. I've spoken with both manufacturers. Neither of them, they can only buy from the one manufacturer of the powder that's called American Laboratories, Inc. And they are US based. The pigs are US based. So there is that. But between the products, same active ingredients, similar inactive ingredients, the recall rate in the past several years has been higher for NP thyroid. Armour Thyroid is more expensive. So that's kind of the trade-off. One has had tighter quality control, but it's more costly. The other has had a few more recall issues, but is often treated as the generic option. There's really not a big clear difference to say that if this person has levels like this or this condition, they should take this brand or that brand. They're pretty interchangeable for active ingredients. And many who have done well on natural thyroid have done fine on either. I certainly have some people to where they've personally experienced one brand working well for them and the other not. And I've seen that both ways. And it's not common. In most cases, they're rather interchangeable. But for some, they do feel a big difference from one over the other. So weight loss is one of the things I mentioned. There have been some data points suggesting that natural thyroid can have a stronger effect upon weight loss than the synthetics can. There was an in-office study that I did at Integrative Health, probably, 15 to 20 years ago. We measured basal metabolic rate, just how fast someone burned calories at rest. And we did this for a large group of people that were all pretty similar size, age, and health status. One group was on natural thyroid. The other group was on the synthetic thyroid. And even doses, rather even blood levels. And what we saw was that the metabolic rate difference between the two was just about 300 calories. So what that means is those taking natural thyroid, their bodies were passively burning about 300 calories more than those on synthetic thyroid. There have been some post-usage surveys for people about how they felt their medication has helped them for weight loss. The majority who have felt that they had a beneficial effect on weight loss were those on natural thyroid. So not huge, compelling, or irrefutable evidence, but some suggestive evidence that it can do better. If you've had thyroid disease, you're on medication, and weight's been a struggle, there may be an argument for doing natural thyroid instead. Not everyone can or should take natural thyroid. I should mention that. Sometimes when it's not recommended, so one is pregnancy. And this is true for all versions of thyroid medication that have T3. T3, it's an active version of thyroid hormone, but it doesn't cross the placenta. So what happens is if mom is taking some T3 and some T4, her blood levels could be stabilized, but there's some fraction of that the baby is not getting. And we can't measure babies' thyroid blood levels directly. So it's always thought to be the case that babies would be undertreated if mom were taking T3. Now, the thyroid itself does make T3 and T4. So how does that work? Well, during pregnancy, the human thyroid makes a greater proportion of T4 than it does otherwise. This is one of the times those changes. So during pregnancy, T3-based medicines are just not appropriate. We're afraid that especially that first trimester, baby may be undertreated. Now, natural thyroid and T3 medicines, there's also some arguments by which they may not be good for those who are over 65. There is some evidence on both sides of that, some saying it's not harmful, but the preponderance of evidence, the bulk of the evidence, suggests there could be risk for elderly people, and specifically risks to cardiac health and bone health. So not recommended there. We also don't have a lot of data points for very young users. So recommendations are 18 to 65, assuming that someone is not pregnant, they need thyroid medications, and also that they're taking a reasonable dose. Now, I've heard many say that if you're on natural thyroid, it's normal for your TSH to be below range, normal for TSH suppression to occur. And I can't think of any good things to say other than that's just not true. So if you're taking too much of any kind of thyroid medication, your TSH gets pushed below range. And this is a risk. This is a risk for cardiac damage, for brain damage, for early death, for bone damage. And I've seen people who have been overdosed for a long time by other doctors, and I've seen all those complications occur. So that's a real thing. And the weird thing about that too is that when you're taking more than you need, it's really common to have symptoms like you would have if you were taking too little. And studies have even shown that those who are overdosed commonly have more weight gain than those who are underdosed. So you heard that right. Those taking too much medication tend to get more side effects than those taking too little. Yeah. But I'm watching for that. I'll figure that setting out afterward too and see what might have went wrong there. Community moderation. Yeah, I've not stopped anything or blocked anything. Okay. So that was the other big point about who should not take it. Now, there is a subset of people who just don't tolerate it. They need the medication, they're not overdosed, but even at small amounts, they will get hyperthyroid side effects. Most common thing that's noticeable is a racing heart. And this is probably somewhere around, 15, 20% of people on thyroid medication. So there's no good ways to predict it. T3 levels don't predict it, but those who are medicated unnecessarily see this a little more commonly. So if you're on thyroid meds, but you don't totally need them, you might be able to get away with a low dose of Synthroid, but you might not tolerate a similar dose of Armour Thyroid. That happens. And there are those who need the meds clearly, but do not tolerate natural thyroid. Even small doses give them that racing heart. So that's one side effect to be aware of. And again, not good ways to predict that. That's sadly more a matter of just trial and error, but it comes on pretty fast. And then with changing back off of natural thyroid, it goes away pretty quickly. So those are the big points I have. Oh, standardized and safe. Yeah, so one thing you hear quite a bit in conventional circles is that natural thyroid is not good because it's not standardized and it varies too much from batch to batch. This is true, but it's no more true for natural thyroid than it is for synthetic. And in fact, the numbers of recalls for natural thyroid is not greater than it is for synthetic thyroid. It was a big problem prior to 1979. Before then, natural thyroid was only standardized by its iodine content and not by how much hormone it had per tablet. But they changed guidelines, and the USP guidelines changed how it was manufactured and how it was standardized soon after then. And so since the 80s, it is standardized based upon hormone content. And there's two hormones rather than one, and it's standardized by the same guidelines and the same quality control criteria that synthetic thyroid is. Quick recap, natural thyroid, it is an option for most people, not an option for those who are pregnant, over 65, under 20, or that just don't tolerate it. It's not a great option for those that don't need thyroid medication, and that's true of all thyroid medications. But for those who do need medication and haven't gotten good control of symptoms, it can be a better option. Now, if you're on medicine and not doing well, first things to think about again are, do you need medicine? And are you on a good amount and not overdosed, not underdosed? And then do you have comorbidities? There's many ways by which your health can change how you respond to thyroid medication. Being low in key nutrients like selenium or zinc or iron can make a big difference, or having poor blood sugar, or fatty liver disease, or parathyroid disease. These things all have big effects upon how your body responds to these hormones. And in my experience, the majority of people with thyroid disease have at least one of those conditions. Many have multiple. Some of those have been shown to be present in more than 84% of people with thyroid disease. So when I work with someone, and my first thought is, why is this not working? Are you on the best amount? Is your body using it properly? One simple thing that changes how your body responds to medication is your iodine status. If you're consuming more iodine than your body needs, that makes you more resistant to thyroid hormones from medications. And that's because those active hormones are also supplying iodine. So when you're above target, you fight them and they don't work as well for you. So high level, if you're on medication, not doing well, there's a finite amount of reasons for that. Please don't think that this is just your lot in life and you're stuck with it. Even if you tried a lot of things, there are reasons, there are workarounds, and there are solutions, and don't give up. I'd love to see your comments still, and I can use that for future topics, and hope to see more of you here on YouTube.